Welcome, everybody. We are working through some technical issues. We'll be getting started soon. We've got Dr. Pitts in the room. We've got a few other people that's popped on with us. This is the opening of Hampton Roads area for KonnectMD. My name is Garrett Williams III. I'm the 3.0 version of those other two great men, and proud to be a part of this team with people like Dr. Pitts, Ms. Tia, and some of our other compadres and co-workers in this new endeavor in our area. And I think what you guys are going to see tonight is going to be really, really, really impressive. And you'll definitely see that it's a much needed much needed piece to what we have as far as healthcare. Keith, you back on with us? Your mic live?
I'm back. Welcome, everyone. Man. Welcome. We'll give us about another 2 minutes. We're going to let it go for about another 2 minutes, and then we'll be ready to jump in. Stand by and get ready for something phenomenal, guys. I hope you're ready. Hope you got your pens and paper ready, because we're in Hampton Roads, y'all. We're in Hampton Roads, and we're about to introduce something that's life-changing. It's going to be life-changing for a lot of people. But in the meantime, just stand by.
Talk to him. Yeah. KonnectMD, yeah, we tapped in. Healthcare membership, we locked in. Not insurance, don't get it twisted. 24/7 dot when you need assistance. Travel discounts, yeah, we gon' slide. Lifestyle club, keep your peace inside. Free mental health, that's real love. We level up, whole life, not just one plug. I was tired of the bills, tired of the wait. Be sitting in the lobby, stressing on my day. Now it's one membership, simple, straight. Phone in my hand, I'm good, feel safe. Late night questions, I don't panic. Tap in quick, get guidance, no frantic. Boss moves only, I'm on my grind. Protecting my health and my peace of mind. This that lifestyle, this that upgrade. Not that maybe coverage, now we get paid. Save on trips, take flights, new scenes. From the city to the islands, live dreams. And my mental, yeah, we keep that strong. Free support when the pressure too long. We don't play with the stress, we address that. KonnectMD, put your life on the best track. Yeah. KonnectMD, yeah, we tapped in. Healthcare membership, we locked in. Not insurance, don't get it twisted. 24/7 doc when you need assistance. Travel discounts, yeah, we gon' slide. Lifestyle club, keep your peace inside. Free mental health, that's real love. We level up.
All right, y'all, all right. So we're ready to get this ball rolling. And we are so lucky to have Tia Thomas, which is going to be our host and facilitator for the night. And of course, the speaker of the hour is going to be the one and only Dr. Casual Pitts. With no other ado, I'm going to mute myself out. And guys, welcome Hampton Roads to KonnectMD.
All right. Well, listen, guys, I just want to thank you guys for your time. I appreciate you guys tremendously for this late evening. So that means a lot to me. So guys, I'm going to share my screen and I am going to dive into what I would like to present to you, a revolutionary healthcare platform that's changing the industry, right? So the rule of thumb is keep your mics on mute. If I do call on your name, I would like for you to unmute yourself and engage with me, because this will be an engaging conversation. So without further ado, join me on this journey and let's get started.
I want you to mark today's date because we will introduce a revolutionary service that millions are unaware of. However, today you have the exclusive opportunity to take advantage of this information before others do. But first, complete this brief survey. Question 1. Do you agree that healthcare costs are too high?
So guys, if you agree that healthcare costs are too high, put a yes in the comment section. And if you believe that it's not too high, don't say nothing at all or put a no in the comment section. But for this illustration, guys, it's definitely going to be a yes for me.
This year, healthcare premiums have rose over 114%. And overall spending. National health expenditure growth is projected to average 5.8% annually through 2033. This means employers, Medicare, and Medicaid will also be affected.
So guys, I want you to pay attention to what you just heard at the very beginning. Literally, as of January 1st, premiums in the healthcare space has literally rose by 114%, which leads me to my next question.
Question 2. Everyone knows at least one of these 3 people? Click the one that you know.
So guys, there's only 3 people that live in the world today in this space. The first one is somebody who already has healthcare, right? They got Blue Cross Blue Shield, Aflac. They already have healthcare in place. Your second person is somebody who receives free healthcare, Medicare, Medicaid, and your veterans. And then your third individual is your typical entrepreneur who typically doesn't have anything at all. So if you know at least one of these 3 people, just put a yes in the comment section.
Fun fact, 27.1 million Americans lacked health insurance, representing an 8.2% uninsured rate for the total population. This number has remained relatively stable, with 25.3 million people, 9.5% of the population aged 0 to 64, uninsured since 2023.
So guys, this number has literally tripled. Now we're looking at 91 million Americans who are literally uninsured or underinsured, which leads me to my next question.
Question 3. What is your number one concern when you are looking at healthcare services?
Miss Tia, I'm calling on you. So when you're looking at a healthcare plan, Miss Tia, what sticks out to you the most? Is it affordability, 24/7 access to healthcare, free prescriptions, or mental health programs?
Sorry, Dr. Pitts. For me, it's affordability.
Affordability it is. Let's do it.
Healthcare has not been consistently considered affordable in America, with affordability being a significant challenge both before and after the passage of the Affordable Care Act, ACA, since 2010.
So guys, listen to this. Before ACA, healthcare wasn't affordable. During ACA, it still wasn't affordable. And now it's gotten completely out of hand, which leads me to my next question.
Question 4. Isn't it crazy how much you have to pay out of pocket for prescriptions even when you have insurance?
So let me paint this picture for you. You pay a high premium for insurance. You have to still pay to use it. And then every time you have to go or administer the prescription, there's a copay and a deductible. Well, here's why.
Another fun fact. Prescription prices are high due to factors like pharmaceutical company profit motives, the high cost of developing new drugs, and patent protections that limit competition. In the United States, a fragmented market with limited price controls and the influence of pharmacy benefit managers, PBMs, also contributes to higher costs compared to other countries. Question 5. Which option do you believe is the number one option for individuals when the healthcare clinic or urgent care is closed?
Miss Crystal, I'm going to call on you now. So let me paint this picture for you. Healthcare clinic is closed. Urgent care is closed. What do you think is the number one selection that people will choose? You got to unmute yourself, Miss Crystal. Uh-oh. She's still muted. We can't hear her. It's okay. Nope.
I'll help her out. I think she's probably going to say the ER.
Okay. There we go. Let's select ER. She's shaking her head yes.
Imagine healthcare that's instant, affordable, and always in your pocket. With KonnectMD, you get direct access to doctors, anytime, anywhere. Skip the waiting rooms and confusing bills. Your KonnectMD membership unlocks 24/7 virtual doctor visits, no copays, no surprise fees, prescriptions sent right to your pharmacy, coverage for your whole family, bilingual care, whenever you need it. Healthcare should be simple. With KonnectMD, it finally is. Join the community of thousands who have found their way to KonnectMD. For just $3 a day, it's a no-brainer whether you have insurance or not. And the best part, for every 3 memberships we sell, we donate 1 to someone in need. Tap below to explore your options. We can't wait to be there for you.
So guys, KonnectMD is a healthcare membership that's not insurance. It provides 24/7 access to physicians, free prescriptions, and you can add up to 7 family members on the plan for no additional cost. Now, as you can see here, we have 4 membership tiers. Our silver is only $60 a month, and that's going to give you everything I just mentioned, plus dental, vision, and chiropractic. Our gold plan is only $80 a month, and that's going to give you everything in the silver, plus access to free mental health and 13 additional specialists. And then our platinum plan is only $100 a month, and that's going to give you everything in the gold and in the silver, plus access to a primary care physician, a free dermatologist, and being able to receive 2 free blood tests that's administered through Quest Diagnostics and LabCorp. And then, of course, our titanium plan is only $150 a month, and that's going to give you everything in the platinum, gold, and silver, plus access to free virtual pet care, a medical debt eraser, and a VIP travel booking engine that will give you discounts on travel. Now, full disclaimer, this is 100% telehealth, which means what? No hospitalization, no brick and mortar, no MRIs, no CAT scans. However, there are 5 services that do require brick and mortar. That is going to be your your dental, your vision, your chiropractic, your blood work, and if you choose to see a mental health therapist in person, you can do so. So guys, let me give you guys the timeline and the history of healthcare. The first thing I want to put your mind at ease at is before urgent care, there was only ER, right? And then healthcare changed. It took a shift, and then urgent care was birthed. And then it changed and it took a shift when COVID happened, and then telehealth was birthed. So what am I saying to you guys? 86% of the people that go to urgent care and ER are literally for non-chronic issues, which means what? These things such as sore throat, itchy eyes, Z-Pack, flu symptoms, all of these things can be handled from the comfort of your home because now a program like KonnectMD exists, right? So with that being said, healthcare is taking another major shift where now telehealth is going to be the #1 priority for individuals. Why? Because you're giving individuals their time back and you're giving them accessibility and convenience, okay? So
Before we get into Q&A, let's recap on this amazing membership.
#1, our program requires no contracts, no commitments. #2, there's no Social Security required, which means our Hispanic, Haitian, Nigerian market completely wide open. Because this is not insurance, there's no such thing as waiting for open enrollment, which means that you can enroll into our program today and use the service the same day. And guys, there's no previous medical history that will get you denied for our program, okay? So when you think about our program, think about Costco and Sam's Club. And when you think about how to use our service, you think about the Uber to healthcare. So this is where I will digress and now open up the floor for any questions in regard to the program that you guys just heard about.
Come on, guys, just unmute your mics and come forward with any questions that you might have. If you don't have any questions, I'll dig in. I'll start asking questions. Come on now, y'all gotta have some questions. Y'all just heard some phenomenal information.
So,
Now,
Dr. Pitts,
there we are.
I'm sorry, Keith.
No, go ahead, please.
I have a question. A lot of people, including myself, I have great insurance through my employer. I've always had great insurance through my employer. How does this service benefit someone who has insurance?
Absolutely. That's a great question. So let's talk about that, right? Your first group of people who, like Miss Tia, has great insurance, right? Where our program benefits those individuals where they have insurance, great insurance, or don't have anything at all, right? Where it benefits those, and not that they don't have anything, we're talking about the ones that do. But for the ones that do, this becomes a great supplement for them. Why? Because there's 3 disadvantages to your great insurance. #1, you cannot see a primary care 24/7. You can only see them from open to close. #2, you cannot add up to 7 people on that amazing insurance without the cost going sky high. And #3, every time you use it, there's going to always be a copay and a deductible that's administered. And when you travel out of state, right, and you're going to another state, typically, depending on how the insurance is set up, there's either A, out-of-network fees, or B, it doesn't work in other states or cities, right? So now having our program in as a supplement, #1, we help meet those 3 disadvantages, right? Now you're able to access a physician 24/7, 365. Typically, the top 1,000 prescriptions that are administered through your doctor or through KonnectMD are going to be free now. And then now you can add up to 7 people onto your KonnectMD plan and not have to worry about hurting your insurance or causing that to go up sky high, because now you have that addition added on through your ConnectMD plan, right? So that it becomes a marriage, it becomes a supplement for those who have insurance. For my second group of people, Medicare, Medicaid, and your veterans, you say, well, Dr. Pitts, they receive free health care. Why is it a benefit to them? Well, the wait times. My mother, who's a Medicare and Medicaid recipient, she needed to get a refill on her metformin. Called her primary care, who she's had for 10 years, and said, hey, I need a refill. He said, hey, I can't give you a refill until I get you into a scheduled appointment. She said, okay, well, schedule me an appointment. He said, no problem, but 45 days out, right? So my mother said, so what am I supposed to do? I need my metformin within about a week. He said, well, you can either go to urgent care or ER. So now, instead of my mother having to do that, she was able to log into a portal, access her primary care physician through ConnectMD. He refilled her prescription same day, had them mailed to her home in 2 days. So now, for that second group of people, we're providing accessibility and convenience. And your third group of people, self-explanatory, your entrepreneurs who typically don't have anything at all. This becomes their primary. So that's how we cater to all three sectors of the industry. Great question, Tia. Any other questions, guys?
I'll jump in with a question, Dr. Pitts.
Yes.
Can you help us understand about the mental health piece? Because as it is May, right? Mental Health Month. So yeah, please.
Absolutely. So guys, with our program, and for those that do not know, mental health is extremely expensive. And we're not talking about just mental health. We're talking about behavioral health, right? Which means what? You may need marriage counseling, right? That's taken care of through ConnectMD for free. You may have a child that's in college and they're having anxiety from their studies. This is taken care of for that. You may have a situation where you're dealing with, or somebody that's dealing with alcoholism, or they have bad habits. This program takes care of that. You may even know a company that handles legal services through that particular company. Well, guess what? It's the same thing over here at ConnectMD. We have that option as well. So guys, behavioral health, we're not just covering mental health. That's just one side of the behavioral health. We're covering pretty much all spectrum. And guess what? 24/7, 365 is absolutely free, a part of your program.
Wonderful, wonderful. So you have access to a clinical psychologist or whoever it may be 24/7.
365, absolutely.
That's wonderful. Any other questions out there, guys?
Can you guys hear me?
Yes, we can hear you now, Ms. Kristen.
Oh, it's working. Okay, sorry about that. Okay, so with the plans, it allows your family members as well to be added to your plan?
So you and 7 additional people. So that's 8 people, guys, on one plan. So anybody that's 25 years and under can be added to your plan. And anybody that's 26 years and over, besides primary and spouse, they have to have their own membership. Meaning that if it's you and your husband, or you and your wife, you guys can be added onto the same plan, no issues. And then anybody that's 25 years and under can be added. But then anybody that's 26 years and over, they have to have their own membership. And here's the thing. My daughter does not live in my household. She's 21 years old. She lives in Chicago. She's on my plan.
So she's logging into the same portal as if you were to log into that same portal as well to access her physician?
Well, so great question. So my daughter's logging into her own portal, because anybody that's ages 18 and over, they get access to their own portal. Anybody that's 17 and under, you're the controller of their portal. But 18 and over, HIPAA says that they're old enough to control their own medical direction.
Okay.
And Dr. Pitts, we have Dexter. He has his hand up. Go ahead, Dexter, and unmute your mic.
Hey everybody, how y'all doing? A great call. I believe this is like way before its time. Like, we finna change a lot of stuff. So, but my question is, how would you go about how do you go about your advertisements? Like, we got social media, we got word of mouth, but is there a place on the back office where I can get like flyers and like put them on my own, you know what I'm saying, make it mine and like advertisement? How what's that conversation like with trying to get people to sign up? You know what I mean? Or
Absolutely.
businesses. I work at the shipyard and I do like contracting, and I got a lot of contracting companies. I want to present them with this for their contractors. See what I'm saying? So how, like, what's that conversation like? That's all.
No, absolutely. Great question. And I'm glad I'm sharing my screen. So you came, it was a great segue, right? So guys, this is what your university looks like with ConnectMD. When I tell you I equip my agents with everything that you can possibly think of, they have access to everything. We have a 24/7 webinar. We have AI phone agents that make outbound calls and take inbound calls. We have a B2B form link for the B2B side. We have a B2B presentation. We can go down here. We got scripts. We have the gas station table permission form. So guys, with our program, and we're going to talk a little bit about that. So we kind of got ahead of ourselves. But when you become an agency or you set up your agency, you're provided with this particular university, right? This comes into your agency. There's no additional cost for this. It comes with your agency. So you're equipped, excuse me, with all of the flyers that you can possibly think of for every service that we have, and you have everything that you need on how to post on social media. So you have access to that as well.
I got a question.
Yes, sir.
Thank you so much for being with us tonight too, and providing the information to, to the Hampton Roads marketplace. We appreciate you. For pet services, is there any limit on pets? Because I know some people have one dog and some people have 10. Is it just restricted to, domestic animals like dogs and cats?
Absolutely. Great question. So guys, this is a titanium portal, okay? For what you guys are looking at. So the great question that was asked was about pets. So if you logged into your portal, you would see this box if you had either pet as an add-on in any one of the memberships, or if you had the titanium membership, you can come here and guys, unlimited pets. You can literally have 50 pets listed here. We have farmers right now who have this program. I think one of our farmers has about 122 pets listed. It's for unlimited pets. Horses, frogs, dogs, cats, snakes. It don't matter. If you got a pet, you can list them onto your program and have access to a virtual veterinarian 24/7, 365.
That's great.
Yeah, that's great. I know a farmer I work with. Let's go.
Absolutely.
Dr.
Absolutely.
Sorry, Dr. Pitts, I do have a question. We have a couple of people that are actually out of town, not from the 757 Hampton Roads. How many states does this program operate in?
Great question. All 50 states and every U.S. territory. Okay. That we have no limitations and we have no restrictions. We operate in all 50 states and every U.S. territory for now. Once we have 1 million lives in our program, then we'll start branching off into other areas such as Canada, Australia, and Mexico, right? Those are going to be our next top tier target areas. And then as we continue to keep expanding, our goal is to be able to hit every continent that exists. But right now, what's most important is that we got 91 million Americans here in the U.S. that need our help. And that's what we're going after right now. Any other questions, guys?
Yeah, one question. How about, those of us that may have elderly parents, and how can this actually help them?
Yeah, absolutely. So number one, if you guys are taking care of your parents, you can actually add them to your membership, right? So as it says here, add dependent. Once you add the dependent, the drop down box here is spouse, child, other, parent is one of those selections. Grandparent is one of those selections. So A, if you're taking care of your parent, you can add them to your membership. B, if not, then you can get them to take advantage of a membership. Guys, listen, I have a whole senior community out of Chicago, Illinois. I call them the silver seniors because all of them have the silver plan, but they got the plan not for themselves, not just for themselves, but for their grandbabies, for their grandkids, right? Because they know that, again, they can add up to 7 family members to that plan. So it's become a great benefit to be able to provide something for their grandbabies, right? So it's extremely affordable. My mother's Medicare and Medicaid, and she's paying $100 for the platinum plan, right? Because she's able to get the top 1,000 medications for free. So when she tallies up her medications with Medicare, she was paying about $300 additional for medications, right? Medicare gave her whatever those discounts were. She still had to pay a copay for those particular medications. But when she got our program, it's taking her from $200 to $300 to now only $100. It just makes sense, right? So, yes, that's how you can add and even help your parents.
Copy that. And you're still sharing your screen, Dr. Pitts.
Oh, I know.
Okay.
I want to make sure that I'm if I need to cover anything from what they want to see is I want it to be right here for them.
Copy that. And what was it? Anna had a question?
Ruby has a question.
Ruby.
If you can unmute your mic.
Good evening, everyone.
Good evening.
Your mic muted again, Miss Ruby.
Okay, can you hear me now?
Yes, ma'am.
All right. So from my understanding in this presentation, thank you so much. So this is essentially telehealth, and you'll have 24/7 access to MDs, prescriptions, and things of that. So let's say you become a member, but there's cases where you would, involving hands-on situations. How would that process go?
Yeah, absolutely. And that's a common question, right? So our physicians guys, we have 65,000 board certified practitioners, right? So, or specialists is what I would like to say. So depending on your situation, depending on what you're going to say to that particular physician and whatever you're going through at that time, they will make that recommendation of letting you know whether or not, A, you need to go to urgent care or ER, right? Or you need to go to an additional specialist, right? Now, if you are somebody who has insurance, then guess what happens? Great. Your insurance is going to take care of all of your catastrophic things, right? But if you are an individual who doesn't have anything, then you're going to be stuck with that bill. And this is where ConnectMD picks up the second area of the medical debt eraser, right? Now you're able to take that bill, add it to the medical debt eraser, and within 90 days, it either reduces that debt to a copay or wipes it out completely, right? So that's what I add to my members who don't have anything at all. They pick this up as a primary. I say, hey, if you feel like there's ever a time where you have to go in, get the medical debt eraser added to your program. So that way, when you do receive that bill, you can then submit that bill to the medical debt eraser, because the way the medical debt eraser works, you don't have to have it for a certain period of time. Anything that's $1,000 or over, they'll tackle. And it can be current or previous medical debt. Living witness. I had $150,000 in medical debt. They reduced it down to about $400. We had an individual who had medical debt for 11 years, $30,000 in medical debt. They wiped it completely clean. He paid nothing for it. So again, that medical debt eraser is a powerful addition, even as a standalone. People say, well, look, I have great insurance across the board, but I do need that medical debt eraser, and they can easily take advantage of that for only $29.99 a month.
I have a question. How many languages does the program service?
So great question. So what I love about our physicians, right? When you look at the portal perspective, it's gonna obviously the two main languages is gonna be English and Spanish. But when it comes to speaking to a particular physician, the physicians speak different languages, right? So what I'm doing is I'm walking you guys through a portal, through a session really quickly. And as you can see here, wherever you go, your membership goes, right? I currently live and reside in Georgia, but tomorrow I'm going to be in Arkansas. So if I select Arkansas, I'm then going to select phone and video. I'll hit next. I'll put in whatever symptoms I'm dealing with at that time. I'm going to hit next. Common questions. Do I require any prescription refills? Yes or no. Now, the provider in Arkansas at this time is and this is my primary care doctor. This is one of our primary care doctors who's licensed in all 50 states. And you can see his language is English, Spanish, Arabic, and French, right? So all you're doing is you in that section, that comment section, you can literally just type, hey, I speak Arabic. I need an Arabic doctor. And then that way they will highlight and give you all of the doctors that speak that particular language. So while the site may only transition right now into 2 languages, we have physicians that speak pretty much all the languages you can potentially think of.
And now we have Mr. Keith Robertson. If you can unmute your mic.
I'm sorry, too many screens. I wanted to kind of dig in a bit on the prescription side of it, the pharmacy side, and your experiences and what you've had to deal with concerning that.
Absolutely, 100%. So guys, there's 2 sides to the pharmacy side, right? The first side is for those that have silver and gold, um, they're only going to receive the top 350 acute medications for free. Okay. And then any medication outside of the formulary, they're going to get up to an 80% discount on. Okay. And then for my individuals who have the platinum and above, they're going to receive the top 350 acute medications and the top 1,000 chronic medications for absolutely free. And any medications outside of the formulary for them also is up to an 80% discount. So what I'm about to do is I'm about to show you guys an example of a prescription. I'm going to go to my mother's, and I use her as a testimonial all the time. But we have the capability and the accessibility to look up prescriptions prior to somebody becoming a member as an agent, right? So when I go down here to diabetics, because that's what my mother is, metformin is the top prescription for her. So I click on metformin, and my mother is 60085. Then I hit submit, and it's a very, very expensive prescription. Okay, it's absolutely $0 for our members. Okay. Now, chronic medications have to be mailed to your home. That's the disclaimer. All chronic meds are mailed to your home, and they're mailed from our Canadian. We have a Canada pharmacy that mails all of our meds for our chronic meds that have to be mailed to their home. So you're talking about not just a specific medication. You're talking about top-notch medications coming out of Canada. So that's pretty much how our program works for the medications. And again, if that medication falls outside of that formulary, you are going to get up to an 80% discount.
Got it. Could you speak to the Skyrizi situation, man? Because I've been talking to people about it. I know we were live when we did that. Mm-hmm. You know, that medication and the discount, it was phenomenal. It was mind-blowing.
You want to give me the spelling of that again?
I will in just a second. Tia?
I got you. I'm on it, but while we're waiting on that spelling, Crystal, go ahead and ask your question. We'll have it.
All right. Mine was just about the debt eraser. Is that just an add-on for each package, or is there any packages that actually already include that?
The titanium. So the titanium package already includes, it includes the medical debt eraser, the travel, and the pet.
Okay, so we didn't have to. Okay, that's perfect. Okay,
absolutely.
That's good. Okay.
All right, and the spelling of that medication is SKYRIZI.
Okay. So guys, we're going to look up this medication. This medication is definitely going to be outside of our formulary, and it'll say not available, right? That means it's outside of our formulary. However, our Canadian pharmacy is not in the US. That prescription is $50. Okay. $50. I want you guys to see what the prescription typically costs, $10,964.99. That's the discount. You know why? Because look at this. This is the regular price, $22,000. Okay. So even if somebody was already accustomed to paying $22,000 and they needed to go pick up that prescription immediately, they would pay $10,000 instead of $22,000. But if they really want to get it down, all the way down, $50 through our KonnectMD program.
Right. Do we have anyone here that wants to play with this screen and tell us the medication? Doesn't have to be your medication. Just throw out a medication because we know all medications are expensive.
100%.
What about the high blood pressure medications? I don't have a specific one, but
Yeah, absolutely. So let's look at, I can tell you, we already got the section already. Look at this. So here's your blood pressure, right? These are all of your blood pressure medications. These are the top ones, right? The one that sticks out to the most is because my mother has high blood pressure as well. And it's going to be this ethanol one. Same zip.
Yeah, I noticed that first one already.
Yeah,
I see that a
absolutely
lot.
free. Absolutely free, guys.
Wow.
Yeah. Any other questions, guys, before we move over into our next section? Okay. If not, then we are going to get back to it. All right, guys. So as I stated before, there are 5 add-ons, and these are either add-ons, standalones, or 3 out of the 5 come into your titanium membership. So the virtual pet care as a standalone or an add-on is $19.99. The medical debt eraser as a standalone or add-on is $29.99. And then the VIP travel booking engine, which gives you 100 room coins every month that can go towards any hotel of your choice. If you do not travel that month, those room coins accumulate. You're going to get discounts on resorts that are not timeshares, 10% cash back on cruises, and then also discounts on local dining and entertainment. Okay. And that's $49.99 a month. And then a GLP-1, and I'm sorry, guys, but those 3 services, those first 3, all 3 of those come into the titanium plan. All right. Your GLP-1 weight loss, for those that like to lose weight fast, you can pay the $375. Right now, there's a discount, $275 for the first month. And that is going to give you the medications, the primary care, the blood work, and the dietitian for only $375 a month. Okay. And then your active SOS works just like Live 360, where it's tracking you and up to 10 people. It also houses your medical records as well. If some medications change with the individuals that you add on there, then you will get that alert. My mother, I have her on my active SOS. And anytime a medication changes, I get an alert and a notification. Okay. If she has a slip and fall, I'll get alert and a notification. All right. So that is that's how the active SOS works. Okay. So these are our add-on services, guys, standalone, or like I stated before, 3 of the 5 come into the titanium plan.
Could I ask you a quick question?
Are you ready to make a difference and get paid?
Yes, sir.
I'm sorry, I don't mean to disconnect you, but I want to make sure that they get the full overview. On the travel and booking, there was a guarantee for pricing. Could you speak to that, please?
Yeah, absolutely. So if you find a hotel that beats the price that we have, we'll give you the difference up to 110%. Yeah, absolutely. Any other questions, guys, before I move forward? All right, so we're going to do a quick transition and talk a little bit about the opportunity side. So here we go.
Are you ready to make a difference and get paid for it? Join the fastest growing virtual healthcare agency in the country, KonnectMD. With KonnectMD, you can help millions of Americans access affordable 24/7 healthcare while building a business that pays you every single month. Earn a $35 bonus for every membership sale, plus 25% monthly residual income, starting with your very first sale. And as your team grows, unlock up to 5% in agency overrides, special bonuses, and even company-paid trips. No experience, no problem. We provide all the training, certifications, and tech support you need. track your sales and commissions with our business CRM, and enjoy nationwide rights to sell. Be part of a movement that's changing lives, saving families money, and rewarding you for your impact. Whether you want extra income or to build a legacy, KonnectMD is your opportunity to shine. Ready to get started? Join KonnectMD today for only $24.99 a month and share the solution. Build your income and become a healthcare hero.
So guys, I like to call this the business in the box with benefits. And what that means is there's two options to have your own agency. Option A is you can say, Dr. Pitts, I just want to pay for the agency that's $24.99 month after month. Or you can do option two, where now you have your agency plus you attach a benefit plan to it, a membership plan to it, to reap the benefits for you and your family, number one. But number two, have the capability to walk somebody through a portal, just like I did for you guys, right? It makes the conversation easier. And guys, I can tell you from experience, it closes the sale a lot easier as well, because people like to see what they're paying for, right? So when you can show them that, you just have an advantage. So having an agency without the membership, it can happen, but just be prepared to answer those rebuttals if you ever come up against those. Now, your agency is set up. The very first thing that's important is, guys, this is not insurance, so you don't need a license. Okay, that's the first one. The second one, my favorite, no chargebacks. So if a member enrolls today and cancels next month, no harm, no foul to the member, no harm, no foul to your agency, which means that we don't chase money, money chases us. And then the third benefit is we provide you the leads where you're able to put in a zip code and it will give you all the companies that are looking for the services that we offer. Okay. Now that your agency is fully set up and ready to go, you put yourself in a financial position to earn a $35 bonus up front, no matter what membership somebody enrolls into. And then month after month, you're going to make 25% of that membership. Okay. So here's an illustration. I love to use this one. If you enrolled 1,000 members into your agency, that's going to give you a $35,000 bonus up front. And then month after month, you're going to make anywhere between $15, $20, $25, or $37,000 month after month, as long as those 1,000 members stay active. And the reason why I like to use this illustration, guys, is because when you think about the average individual that works a 9-to-5 job, they give themselves to that job for over 30 years. And when they retire, I guarantee you that they don't walk away with $15,000 a month. Okay. They walk away with making about $2,500, maybe $3,000 a month, if that, right? And a service package that may only last them for about a year and a half. Okay. What I'm saying to you is that if you put the time, the effort, the skill set in learning this program, and let's say it took you 3 years to get 1,000 enrollments, would you feel that it would be worth you making now $15,000 to almost $37,000 a month? I don't mean to speak for everybody, but I believe that that would be extremely beneficial for everybody on this call to know that you poured 3 years into something that could potentially pay you that kind of return, right? So when you look at 3 and you look at 30, you kind of pick and choose wherever you want to sit at, right? Now, what you see is what you personally can do. That mind frame I put you in is what you personally can accomplish. However, you can get there a lot faster if you put somebody else in a position to have their own agency. What I love about our model is we don't have the MLM model. We have the insurance model, just without the license. And what does that mean? In the insurance world, they don't get paid to recruit people, right? However, you make a percentage off the book of business that your agents write. So your level 1 agents, you're going to make 5% of the book of business that they write month after month. Your level 2 agents, you're going to make 3% of the book of business that they write month after month. Your level 3 agents, you're going to make 2% of the book of business that they write month after month. And levels 4 through 10, you're going to make 1% of the book of business that they write month after month. So guys, that is the opportunity side and the service side of our program. This is where I now digress again, and we can open the floor back up. If you have any questions about the services that might have came to mind, or even the opportunity now.
I have a question.
Yes, ma'am.
Let's just say I have two people who would like to have their own agency.
Mhm.
And we're working together to gain members. I bring them in, I guess, under myself, and they already have 5 people that they know need the service and they want to sign them up. Now, I've signed those 2 up, but those 5 people are connected with them.
Mhm.
Is it a sense of me working with my 2 to get those members signed up and the percentages coming off of what my members make, or is it more so off of what I get after those members are added to the 2 agents that want to build, if that
Yeah.
makes sense?
No, it makes perfect sense. So if your agents enrolled those 5 people, they're going to get 25%. You're going to get 5%, right?
Okay.
Because those are your
Mhm.
level 1 agents. You're going to get 5% of the book of business that they write, right? They're
Mhm.
going to be happy because they just closed on 5 people at 25% of whatever membership they enrolled in. You're going to be happy because you're going to get paid 5% of helping them make sure that those deals are closed for them to get the memberships. That's what I love about our program, right? So
Okay.
while they did all of the footwork, all you had to do is come in and
Mhm.
make sure everything was good. And now they're getting compensated and then you're getting compensated.
I love that. Okay. Awesome. Thank you.
Absolutely. Any other questions, guys?
So since we started this conversation, is this a MLM?
So we have we have a framework, right? But the beautiful part again, like I stated before, a lot of the reasons why those MLMs get targeted or they crumble is because number one, they do the pay to play model, right? And we've grown into that industry where, the bigger pioneers like an Amway, and all of the herbal lives, they have the structure to be able to sustain and maintain that particular model, that particular space. With our program, I'll give you guys this. When was the last time you saw a big skyrise, State Farm, or Geico building crumble? They don't. Insurance has the most solid foundation in the world, which is the reason why we built our comp plan off of that particular foundation. So, and what MLM stands for is multi-level marketing, right? So we have when I say the framework is where now you're able to get paid off all of your levels, but you're making a percentage of the book of business, right? Just like insurance companies do. They make a percentage off their agents and their brokers' book of business. Same thing with real estate. Real estate makes a percentage off the brokers of the book of business that brokerage writes, right? So we have that same model without the pay to play model, which is what's going to keep us in the industry for as long as we've been in it now 6 years. And though that side, we've had no issues with the way we're structured.
So to be clear with ConnectMD, it's actually like 2 systems working simultaneously. So you can
So,
be a member and have the service
mhm,
and never be an agent. And then you
that is
can be
correct.
an well, if you're an agent, then you probably want to use the service anyway. So
But
okay.
but to your point, you can be an agent and not have a membership, right? But when you think about it, you're going to make so much money in this program. Your membership and even your agency is going to be free. Like giving you guys an example, if you came on board, let's say you came on board as an agent only, and you're still responsible for your overhead of $24.99. Well, one sale knocks that out. If you came on as a titanium agent, right? 6 memberships knocks that completely out. Now you're not paying for your titanium membership, nor are you paying for your $24.99. It's free. So guys, what I'm saying to you is that the membership itself, if you become an agent, is going to be free. So why not? I don't even know when the money comes out of my account for my agency nor my membership. And I have the titanium plan. So for me, it's like I don't $180 where? I don't see that. And that's an extreme. Talking to my business owners, I believe that you can all contest $180 a month for overhead is extremely low. And as I peeled back the layer and started, and I'm a traditional entrepreneur, right? I'm looking at my companies that I've built, and I've said to myself, I've given these companies 5, 6, 7 years of my life, and neither one of them are paying me the amount of money I'm getting paid over here. Guys, I'm making over $580,000 a month. I'll say it again, $580,000 a month into this program. So when it clicked for me, I sold 5 of my companies because I said it only makes sense for me to go in full time here versus giving myself the time and effort into my companies, right, that I've built for years, and neither one of them are reaching me that kind of royalty. And you know why? Because guys, in the industry that we're in an industry that's never going to go away. Healthcare will always be here, just like insurance will always be here. So we're in a never-ending industry, and to have something that the gentleman said earlier is that it's ahead of its time. With the way our program is designed, it absolutely is. And come June 19th, guys, we're going to change the trajectory of the way healthcare is going to be looked at with the new features and the new services that we're going to be adding to this platform. We're literally going to be suffocating all of the other telehealth companies with these new features that we're going to be adding come June 19th at our convention.
So I want to know, to everyone that's still here, thank you for still staying on to listen to the presentation. Had anyone heard of KonnectMD before tonight? You can write it in the chat or you can unmute your mic.
Have
you heard of KonnectMD before tonight?
Before tonight? Oh, yes, I have.
No.
Mr. Tony said no. And guys, that's going to be the typical answer, right? So if you said no, imagine the 5 people that you know or the 10 people that you know. They also said no, right? They're going to also say no. Here it is. I'm in Columbus, Georgia, and it's over 200,000 people that live here. And I can tell you right now that I can go up the street and around the corner and talk about KonnectMD to people, and they'll still say, I don't know. I haven't heard of it. So when you're talking about we're nowhere near in a saturated market, and we have over 600,000 active paying members, guys, and that's nothing. When you look at the numbers, go look up how many members Netflix has. 328 million people are subscribed to Netflix, right? We only got 600,000 members. When you pull up how many people live in your state, it's going to be in the millions, and we only got 600,000 members. So when I tell you saturation is not something to be concerned about at this moment, maybe in the next 15 years, maybe. But I want you to think about 15 years, what kind of income that look like. Now, I already know where I'm gonna be at in 15 years. I already know that I have no shadow of doubt in my mind I'm gonna be pulling at least $5 million a month in the next 15, 20 years. Easy, because of the industry. The industry that we're in is never going to go away. And we're in a great position. And let me build this position for you guys, right? Before we answer Mr. Keith's question, I want you to think about this. The very first paradigm shift was when Netflix approached Blockbuster and said, hey, y'all, we could do this X, Y, and Z. We good. Oh, and it was Redbox. My bad. Redbox it approached Blockbuster, and they was like, no, we good. We gonna stay. And what happened? They got taken out of business. And then Redbox got approached by Netflix, and Redbox was smart and said, absolutely, we'll do whatever we need to do, right? And now look where Netflix is at. I'll give you another one, which is something that everybody should be aware of, is cryptocurrency. When Bitcoin first started, they were like, oh man, that ain't nothing. That's digital money. It don't make sense. But now look at Bitcoin, right? I guarantee that if people knew, if they knew what they know now, they would have sold their houses, cars, and everything, would have invested everything they had into Bitcoin, right? Now it's becoming the new payment gateway. And now the new one that just has arose and everybody and their mother is using it is AI, right? So guys, what I'm telling you is that this is where we're headed in healthcare. Telehealth is the new thing. And if you do not remember, just go back to COVID. COVID will remind you why platforms like this exist.
Absolutely. You know, Dr. Pitts, I just wanted to bring forward a little more about KonnectMD from the standpoint of the humanitarian aspects of KonnectMD and what you guys do in the community. You know, for every third membership that's actually sold, one is given away. You know, that's phenomenal. that's phenomenal when you think about it. And you're thinking about those numbers. For every 3 members, 1 is given away. You know, guys, we're put in a unique situation here in Hampton Roads. And by the way, it's 1.9 million people in Hampton Roads. I didn't say Virginia. I said Hampton Roads, 1.9 million. Depending on what statistic you look at, you're going to be looking at 1.7 between 1.9. Okay, in Hampton Roads in the 7 cities. Now, my thing is this: is that as an agent, as an insurance agent myself, you know, and the reason why I gravitated towards this opportunity was because when I sit down in front of a person and I tell them that health insurance is going to cost you $600, $700 a month, they would immediately, I would see it in their eyes, you know. And sometimes it's sad because they can't afford it, and we know they need it. You know, we hear the stories about individuals having to make a decision between their medicine and eating. You just saw the power of what KonnectMD does as far as the pharmaceuticals and being able to reduce that cost. But being able to put 7 family members on the plan, if you have great insurance, put 7 people on it and see what that premium is. But we really have an opportunity here to do something great for the community and do something great for our families. I know some of you guys are here purely for the services, which is great. But then the other ones that are here looking for the business. And again, this is not an MLM, guys. We're not looking for individuals that just want to go out and get a whole bunch of team members and think they're going to run the city. It's not that type of party. So I just wanted to say that, Dr. Pitts, I really appreciate your time today. And I know you're not done yet, but I just wanted to get that out. That was on my chest.
Oh, no, I appreciate that, Mr. Keith. I'm glad that you brought that number up that you just talked about, though, in your area. And I love to break things down in a simplistic manner. I think we all know the numbers game, that if you got a big number, you're only going to probably get about 10%. So they say, right? But let's just say worst case scenario, 10% of that is 190,000 enrollments. And I'm looking at 18 people on here. And if you divide that 190,000 by 18 people, that's at least 10,000 memberships in each one of you guys' organization. I want to tell you what kind of income that is on a monthly basis. That's $150,000 a month. So now if you took that 150 and you just divided that by 2, that's 75,000 a month. But let's go further than that. Let's divide that by 2. That's 37,000. Let's divide that by 2. Guys, I'm talking about 6, right? 6 years, $18,750 a month. And I don't mean 6 years. I'm talking about now you're talking about that number to where now you're taking the 10,000 and you divided that 10,000, guys, by 6 times, right? You're looking at literally 1,666 members. And that number was done at the silver level. Okay, that's only $15 per month per member. Okay, 1,666 members will bring you $25,000 a month. Now, if you look at the number that y'all are a part of, 1.9 million, easy work. Easy work. Now, I'm trying to stay out of Hampton Roads. Now, if y'all need some help, let me know. I'll come in and I'll maneuver a little bit. Because that's a big number now. That 1.9 million, that's a big number. But those are the guys, when I tell you that it's so much money for everybody to make out here. You just got to go get it. You got to go after it. You got to go get it. Guys, you got business owners. You got institutions, organizations, NAACPs, urban leagues, chambers of commerce. Like those are your 3 key sectors to start with, right? Then you got the database to put in a zip code that's going to give you all of the businesses that you can service with KonnectMD, right? Let alone your regular networking events that are going on in your local areas all the time, right? So it's endless, guys, to be able to get in front of the right person. The municipalities, right? You start talking to politicians, they start using this program as a campaign run because they want to be the solution to the problem, which is healthcare. If Donald Trump couldn't have done nothing wrong right, he erupted the healthcare system and opened up the door for ConnectMD to come in and bridge the gap and start to take over in this space.
Now, I know it's getting late, guys, and I really appreciate you guys staying on this long for the launch. We're very excited in Hampton Roads, but it seems like Miss Anna Ruby wants you to go back, Dr. Pitts, to that slide with the startup costs for the agency. If you could show us one more time, please.
I sure can. Absolutely.
I'm going to put her on blast right quick. This is actually one of my bestie friends. We're actually in urgent care together, so we know all too well about healthcare costs and just health situations. We've seen it all in healthcare.
Absolutely. Absolutely. Okay. The chart is up.
We'll be winding down in a few, folks, but if you have any questions about this or anything that you've seen tonight, please ask questions now. Again, thank you for staying, and whoever invited you, if you have questions, days from now, weeks from now, please get back to the person that invited you to this presentation, and they will answer all of your questions.
I have a question.
Yes, ma'am.
Do you guys provide like handouts or pamphlets? If we were to like something to hand out, like we was to go out and set up a table, something that we can lay out that promotes the business, or is that more so just some things you have in the back office that we can kind of print out?
Yeah, so we have it to where you can have that information and print it out, put your information on there, and then you can get that printed out. Now, we also have a discount for all of our agents through Office Depot and Office Max, because they're under the same umbrella, where you get an extreme heavy discount on prints that you can utilize, from ConnectMD. And you have all of that information is housed in your agency.
Okay. In the back office?
Yes, ma'am.
Okay, gotcha. Thank you.
All right, Mr. Keith, do you have any last words? We don't want to keep everyone here too long, but again, we're so excited in the Hampton Roads that we affectionately call 757 to have this service here for all of our friends, family, and community. You guys probably know, I hope you never experienced this, but when you come into a situation where you really need service that you feel like you can't afford just to live day-to-day life, whether it be prescriptions or being able to go to your doctor, it's really heartbreaking. So to have this service come to Hampton Roads, we're very excited. And like Dr. Pitts said, it's not overly saturated. It's not like some of these other companies where they're like 7-Elevens on every corner. We are literally new to the area, and we're just trying to get the word out so we can help our communities.
Absolutely. I just want to say thank you again, Dr. Pitts. Really appreciate you taking time out of your busy schedule. And this man is busy, y'all. We're blessed to have him here. And what we're going to work on, Dr. Pitts, is actually having a opportunity to bring you out so we can talk to the people directly. That is the next agenda. So you can come out and touch and feel someone. But I just want to thank you guys that have actually showed up tonight. I mean, it means a lot. Hopefully you got understanding of what it is that I've been saying for the past couple weeks and what I will continue to say. But, please get back with the person that invited you and have a conversation. Have some tea. And if you got any other questions, you can definitely filter them back to me. And if I can't answer them, I'm going straight to the source, Dr. Pitts. But again, thank you guys for tuning in to the Wealth Expansion Forum in Hampton Roads, launch of ConnectMD.
All right, guys. Thank you, guys.
All right, thank you. Have a good night.